In 1978, the Kenyan government embarked on an ambitious plan to boost milk consumption under the famous Nyayo school milk. It targeted 4.3 million school-going pupils in 11,000 schools countrywide. It, however, became unsustainable and was ended in 1998.
The children who are going to school, they're able to get milk, and it was really for the first time when the government was providing that facility, the school milk. We saw a lot of increase in the number of registration of school-going children. It also helped in terms of their nutrition. It went up, and it developed a culture of milk drinking. That's why Kenya, the per capita consumption of milk is the highest within the region. We are talking about 110 liters per person per year. Well, because of challenges in terms of sustainability of the project funding, there was a challenge because it was donor-driven. So when the structural adjustment programs came in, it affected the budgeting of the government and the support, because there was need then to restructure the funding of the government. We also went through that period when we did not have the school feeding program, and we saw the impact. One, a lot of children now became malnourished. There were no incentives to go to school because there was nothing really to drive the children to go to school, because if they're hungry, they'd rather stay at home than to go walk long distance for schools.
Data provided by the International Dairy Federation shows that globally, at least 160 million children currently benefit from receiving milk at schools, with evidence showing the multiple benefits generated through school feeding programs. In 2004, Kenya Dairy Board, whose mandate is milk promotion in Kenya, partnered with several stakeholders to strategize on how to sustainably reintroduce the school milk program. The aim of this was to expand the domestic consumption of milk and milk products and boosting nutrition for the children in a targeted age bracket.
We are also enhancing our school meals feeding and school milk program. I am pleased that Kenya is taking leadership in the School Meals Coalition as a critical driver to institutionalizing nutrition-based school feeding programs in all participating countries.
We have reintroduced the program in 2007, and so far we have 7 counties who have adopted the school milk program and are able to reach out to about 300,000 public students, that is the ECD centers. We also have private schools who are also having this included in the school milk programs. Then there were no policies in place. We are now having policies in place. Together with the national and the county government, we have developed policies that are used for sustainability, where even the county governments can be able to fundraise. We only had one processor, the KCC. Now we have many other processors, and the counties can be able to promote the farmers' milk within the counties, and we have examples like Muranga, we have examples like Nyandarua, where they are high producers of milk.
The school milk program plays a vital role in decreasing malnutrition in school-going children whose nutrition may be compromised. According to the World Health Organization, malnutrition contributes by over 50% to child mortalities. School health and nutrition interventions have also been recognized by the United Nations as critical in addressing sustainable development goals.
Just a glass of milk comprises all the nutrients that a child will need. If you are to help that, and then if you introduce milk at an early age, when the children are going to school, then it can help. Number one, in malnutrition. Number two, the registration or the number of children going to school will increase.
The benefits of course, of school milk to these children has, of course, the impact of the nutritional aspect, which is, of course, the calcium, the phosphorus, the vitamin B12, and among other things. So it is very key for us to implement, because it has the benefits of the nutrition and, of course, the positive impact on the dairy sector in terms of livelihoods. When you look at the SDGs, the UN Sustainable Development Goals, look at the ending of hunger, look at poverty elevation, and of course nutritional aspect. This is able to address some of those SDGs
That means
on the UN.
through this one program we can be able to, at least try to strive to achieve about 3, if I'm not wrong, of all those sustainable development goals set by the United Nations.
Yes, that is very, very true, and that is why this program is very key.
Yeah.
Just to note in the educational sector, and of course in the dairy sector, because it's going to transform livelihoods. And of course we know these are the children, these are our future, and there is need for us to ensure that their health is key.
Yeah.
And of course we'll be able to reduce issues of diseases. And especially now when we have issues of COVID, with this kind of nourishment, we'll be able to limit issues of disease and hospitalization through this program.
So what is being done differently to ensure sustainability of this initiative this time round?
In terms of trying to see how sustainable the program can be, is to scale it down to that very early age, so that you've got few you're able to sustain. The national government and the county government, who takes what responsibility? And it's very clear in the constitution now that the early childhood development education is left to the counties. So we expect now the counties to start working on that because they are better placed to now provide a budget for it and support the early childhood education programs in their counties. The private sector are also looking for the market. Whatever we produce, we must also consume. So that's one area that private sector fits into that space very well, because they will be having contractual obligations with the county government to supply milk. Number 2, the issue of the county government supporting the farmers in milk production. So they will be able to support farmers to increase milk production. At the end of it, the private processors will pick the milk, collect the milk from the farmers, process it, and then bring it back to the cycle to consumers, starting from our children. Now, that way, there is sustainability in terms of the dairy farming in the country.
So far, over 800 private schools and over 327,000 school-going children from 8 counties have implemented school-based milk programs, which are serviced by several milk processors. As the school milk program gains traction, it provides a multitude of benefits for all value chain actors, be it nutrition for the children, profits for farmers and businesses, investment opportunities within counties, to contribution to the national government's GDP. There is therefore need for all stakeholders to rally behind this initiative to make milk available across the country. To find out more about the school milk program, visit the Kenya Dairy Board website, www.kdb.go.ke.